All right, now that we know how to access our medication library, we're going to use epinephrine as an example for how to run a medication through the medication library. So let's think about epinephrine. We have it all set up. We know that we put 2 milligrams in 500 mLs. We've already labeled our bag. We've primed our tubing, and we're ready to start our drip. So we're going to select New Infusion, select Fine, select epinephrine. And you'll see it's going to ask us for 2,000 micrograms in 500 mLs. You're saying to yourself, but we said we were going to put 2 milligrams in 500 mLs. Why do we have to switch it up and do math and go over to micrograms? Well, it turns out that the pump will only accept the medication quantity in the same unit of measurement that you're going to run the medication. And we run epinephrine in micrograms. We start out at 0.1 micrograms per kilogram per minute, which means that the pump is going to require us to enter our quantity of medication added to our diluent, which is our 500 bag, in micrograms. No reason to worry though, it's simple math on this one. We have 1 milligram equals 1,000 micrograms. So your 1 milligram vial of epinephrine has 1,000 micrograms. We're going to add 2 milligrams to bring us to 2,000 micrograms. We're going to select 2,000 micrograms in 500 mLs. We're going to enter our patient's weight. We're going to get to this screen here. Anytime you see this screen here, you want to enter 2 out of the 3 things the pump is asking you for. So it's giving us the opportunity to enter in a dose rate, VTBI, which is volume to be infused, or a time. We want to enter the 2 of these that don't require any math. So we're going to enter our dose first. And if we didn't know our dose, we have our reference cards. But if we want a reference through the pump, we can look up here in the top right-hand corner, and we can see that up there in the corner, it's going to give us the dose range in red. If we try to enter a medication dose outside of that range, the pump's not going to accept it. So this is one of those safeguards that the pump has to make sure that we enter the appropriate dose. So we're going to enter our starting dose of 0.1 mics per kilo per minute. We're going to enter our volume to be infused, which is our volume of our bag. And the pump's going to calculate that would run for about 3 hours and 42 minutes. We're going to now look through this checklist here and make sure that everything is correct. Our medication name is epinephrine. Our dose rate is going to be 0.1 mics per kilo per minute. Volume to be infused, that's our total bag size, is going to be 500 mLs. And the pump figured out that's going to, at that dose, it would make us run 3 hours and 42 minutes. Hopefully, nobody's transporting more than 3 hours and 42 minutes with a patient on an epinephrine drip. And the concentration of medication to be 4 mics per ml. And if we look back at our math page here, we know that we put 2 milligrams or 2,000 micrograms into 500 ml, which will bring us to our concentration of 4 micrograms per ml. So we want to pay attention to this screen here, because this is going to be that last chance to make sure we didn't make any errors. So we know we have epinephrine. We know we're going to be running it at 0.1 mics per kilo per minute. Our total volume to be infused is 500. And like we just saw on the last screen, we're going to be running that at a concentration of 4 mics per kilo per minute. And now we should be ready to start our epinephrine drip. One more time, we have 2,000 micrograms total available, 500 mLs, and our patient weight of 90 kilos. We've already primed the pump. So now we're ready to start. And you can see that the run light, which is going to be right up here on the side, as long as that light is green, your pump is running. and it's going to have numbers right here that are going to be counting, and they're going to keep telling you how much has been infused. So if you want to make sure your pump is still running, these are the two places you want to check. And I can see that the green run light is blinking and that the numbers are changing, that we're still infusing the medication. All right, so now that we have our epinephrine drip running, we want to know how to titrate our epinephrine. Before we can talk about how to titrate our epinephrine drip, we need to do a quick review on what we want to titrate our epinephrine drip to. Titration of the epinephrine drips has probably been the source of the most confusion when it comes to the IV pumps. Inevitably, on training, and we've seen this in both the clinical or the simulation scenario and in real life scenarios, is that there's a natural tendency to want to titrate the epinephrine drip differently than it should be. So let's go back first and say, what is our goal? What are we usually working towards? Well, we should have a MAP pressure generally we're working towards, a mean arterial blood pressure. So we're going to say 65 is our goal. And that's normally where we're shooting for. And we're going to say our patient weighs 100 kilos because, you always make your patient 100 kilos when you're doing medication math. It just makes life so much easier. So we're going to say that we have this patient, and they're running at a dose of 0.1 mics per kilo per minute. So 0.1 mics per kilo per minute. Because we have to run our epinephrine drips on adult and pediatric patients in a weight-based setting, according to the Department of Health, if we're going to use epinephrine drips in the field. So we have our epinephrine drip running at 0.1 mics per kilo per minute. However, our MAP pressure over here is still only 60. You say, well, that's not where we want to be. Our goal was to be up at 65. So we're going to titrate our epinephrine drip up. And what happens is when we go to titrate up, we're at 0.1. We need to titrate up to something. There's a natural tendency to want to titrate right up here to 0.2. You're at 0.1, it seems very intuitive to go to 0.2. And again, in trainings and review of calls, we've seen this come up, that people want to jump from 0.1 to 0.2. And it seems to make sense. You would think, well, I'm at 0.1. Let's just go up to 0.2 and see if it's working. So let's pretend that we did that. We jumped up here from 0.1 and we went right on up to 0.2 mics per kilo per minute. And once we got up to 0.2, though, we realized that, oh no, we overshot. So our MAP is now 85. And we say, all right, well, we know that's too high. We don't want to run epinephrine too high. We know that does bad things. It creates more workload on the heart, increases the oxygen demand, it vasoconstricts the brain. Just bad things happens when we run that too high. So we say, all right, well, I'm not sure what happened there. I thought we needed to go from 0.1. We went up to 0.2. So let's go back. Let's cut back to 0.1 again, because we're at 0.2 and that's too high. So let's go back to 0.1. So what happens is we go back to 0.1 and we're going to say that we take our MAP pressure there right back down to, let me scroll down here a little bit, to 60. And I will say this might be a little bit of an exaggeration on how quickly these pressures will change or how much influence you're going to have on a single titration. But to illustrate the point that at 0.1 we're too low and at 0.2 we're too high. And this makes sense when we look at the actual amount of medication that we're giving the patient. Not weight-based, but when we figure out how much medication that actually is. When we were at 0.1 mics per kilo per minute, we were giving 10 micrograms per minute. When we titrated up, even though it didn't seem like much when we went up to 0.2, that takes our patient's amount of medication they're getting per minute to 20 micrograms a minute. And then when we titrate it back down, we took that medication back down to 10 micrograms per minute. So if we say, all right, well, look, when we were at 10 micrograms per minute, let's draw a line here, 10 micrograms per minute gave us a MAP of 60. 20 micrograms per minute gave us a MAP of 85. 10 micrograms a minute again gave us a MAP of 60 again. Maybe we need to be somewhere in between. Maybe there's a sweet spot that we didn't meet between 10 and 20 mics a minute, because there's a lot of numbers in between 10 and 20. But when we look over at our weight-based here in green, We say, well, we were only jumping from point 1 to point 2. So we need more titration points. And if we look at the generally accepted range, I'll do that there, that epinephrine drips run, it turns out that that range sits right up here between 7 and 35 mics per minute. So if we look up here at 7 to 35 mics a minute, we now realize that when we were jumping from 10 to 20, we were really jumping around in that range. And that's probably why at 10 our patient's blood pressure was too low, and at 20 it was too high. So the question is, how do we achieve these ranges in between that 10 and 20 when the numbers that we put into our IV pump have to look like 0.1 and 0.2? And that's why our titration uses intervals between 0.1 and 0.2. So when we're titrating up on our epinephrine drip, let's say that for purposes of our little scenario here, and again, these numbers are probably going to have to be too simplistic on how easy it is to titrate these drips, but let's just say that, for our sake, a dose of 14 mics per minute was going to equal that map pressure of 65 that we wanted. We're going to need to enter into our pump a weight-based dose to reach that. And the way we're going to do that is we would have put into our pump an amount of 0.14 mics per kilo per minute. So we can have a dose, what is that blue there, of 14 mics per minute. So we need to influence our micrograms per minute by entering in our weight-based dose at smaller increments. And how we do that is by using the 0.1 mics per kilo per minute. We all know that's our starting point. And then our next titration point would be 0.12, 0.14. And I think this makes a little bit more sense when you can look over here and see that we're influencing our actual medication we're giving by, now we're at 10 micrograms per minute, now we're at 12 micrograms per minute, now we're at 14 micrograms per minute. So this actually makes more sense when you look at it in this column over here. When you look at the amount we're giving per minute, it says, okay, well, that makes sense to go from 10 to 12 to 14 and work your way up that way. But because we're entering these medications in a weight-based setting, we have to titrate up by 0.1, 0.12, 0.14. Now there is another challenge with this though, and that is sometimes we're not trying to get from a map of 60 to 65. Sometimes we have this patient who maybe was in cardiac arrest, we got ROSC on them, or profound cardiogenic shock, and we say, well, I can't even get a blood pressure. Like, they don't have an obtainable blood pressure. I have a very, very faint carotid pulse, and I can't even obtain a blood pressure, and we're going to start them out on epinephrine drip. And we start them out at that 0.1 mics per kilo per minute, like we talked about above. And what's going to happen is when we start them out here at 0.1 mics per kilo per minute, we say we wait about 3 to 5 minutes and see what their blood pressure does. Well, what if after we wait 5 minutes, we really still don't have much of a detectable blood pressure? And we are going to go to, all right, that's our next titration point we talked about up there earlier, is 0.12 mics per kilo per minute. All right, so now we're going to do that. We're going to wait another 5 minutes here. Just kind of hanging out and see what happens. And that still didn't work. Now we're going to go up to 0.14. And let's pretend for the purposes of this scenario that the patient probably needed some type of epinephrine dose. This patient was pretty sick, and they needed a dose all the way up somewhere of about 0.3 mics per kilo per minute. What's going to happen is you can see if we keep going up by 0.2 at each titration point, it's going to take us a very long time to reach these higher doses. And some of these patients do need that higher dose to prevent them from going back into cardiac arrest or maintain perfusion. So we can skip titration doses. There's not a firm rule that says you must use 0.1, you must use 0.2, you must use 0.4. There are cases where we started the patient at 0.1 and the patient, rearrested, and we got a milligram of epinephrine, you got pulses back, and you're starting your draw. Let me start out at 0.12, and that's just not going to work. And we might use 0.2 mics per kilo per minute as a starting point. So it is okay to use a dose that's not 0.1 as a starting point, but when you titrate from that starting point, you want to make sure that you're titrating in increments much smaller than 0.1. So you want to be titrating, say we start at 0.2, and we need to start titrating down. We titrate down to 0.18, 0.16, and so on. All right, so now that we know how we're going to titrate what we're going to titrate our EpiDrip to, how are we going to do that? And that's where we typed it in. It's going to ask us to confirm. We press OK. So the titration is pretty straightforward. We're just going to press the number, enter in our new dose. So we're going to 0.14, press OK. The pump will confirm our new dose, and we press OK to confirm it. And that's titration of the EpiDrips.